Well, crisis intervention training is not a new concept to those who are entrenched in the representation of persons with mental disabilities in the criminal justice system, but it remains in a very uncertain position within police departments around the country. The cities that have chosen to implement it are almost all positive results, but there are certain issues of implementation that remain. First, obviously, there are financial commitments, and second, in rural areas especially, it's difficult often to do this training. There are multiple programs that are referred to as crisis intervention training, but again, the best known one and the gold standard is the Memphis model that was developed first in 1988. So we're not talking about a new program. This is almost 30 years old. Done by the Memphis Police Department in partnership with NAMI, the National Alliance for the Mentally Ill, the University of Memphis, and the University of Tennessee. It utilizes a combination of lectures, role-playing exercises, and interactions with individuals with mental illness over a 40-hour course to give police some grounding in how to deal with a problem if they're called for assistance with a person with a mental disability. It supports partnerships between psychiatric emergency departments and police departments, and that increases the likelihood that people in psychiatric crisis will be transferred to an emergency room rather than to a jail if an officer with the CIT training responds to the call. There are more than 2,800 CIT programs in operation now in 47 states and Washington, D.C. In some states, it's part of an overall improvement of community mental health services plan. In other states, they're standalone, and often they begin after a particularly troubling interaction. In Oregon, the death of an individual named James Chassie prompted the mayor of Portland, Tom Porter, to pledge $500,000 of city funds to initiate a CIT program. Chassie, who was a person with schizophrenia, suffered broken ribs, a broken shoulder, and internal injuries after an encounter with the police. Police said they had a call about his behavior, and he was acting odd. That's a direct quote from the transcript. And he was killed after he ran away from officers who were approaching him. And his death prompted an outcry from the local media and from advocates, and it led to the CIT program. Most departments who buy into the CIT model train about 20% of their staff. But again, this is a problem that becomes more of a problem when you look at the contrast between urban districts and rural districts. An urban department like New York has the resources to take some members off the streets to train them and still have enough people for street patrol. But a rural department with very, very few officers is going to have difficulty in this. The logistics are different from jurisdiction to jurisdiction, but there are some set patterns. Mostly CIT initiatives come with an increased awareness of and resources for community mental health services. In New York City, officers trained in CIT are going to be taught that individuals can be brought to a diversion center where that individual will not face charges for whatever nuisance crime he was picked up on, but instead will be able to meet with staff, including social workers, counselors, and nurses, to assist in connecting that individual to mental health services. And one problem I see is that there's no attorney in this diversion center. And I believe that a therapeutic model calls for an individual who is brought to this kind of a center have a lawyer to talk to about any ongoing legal issues. If there's one thing we know, it's that this population always has a multiplicity of legal issues. But this has not been addressed in the training manuals about any operating center that now exists. And one of the things we can't ignore, we have to look at, is the level of disdain that many police officers have for mental health facilities and their contempt for the mental health system, which they perceive as doing nothing. These are direct quotes from police officers who have been polled about this. And this contempt is even more important because of the extra time it takes to process an individual in a hospital rather than a jail. How long estimates are it takes 2.5 times as long for a policewoman to drop off an individual at a hospital than it does at a jail. And there was a survey, and multiple police officers commented spontaneously, almost verbatim, it is too much of a hassle to bring someone to a hospital. And even more significantly, A significant percentage of police officers who were questioned by researchers had no idea if there was even a mental health liaison in their department. And that strikes me as very problematic. Now, most states have at least one department where at least some officers are trained in crisis intervention technique. But the news that continues to emerge about jails such as Rikers Island in New York, which is one that I'm very familiar with, the fact that that remains one of the nation's biggest mental health providers tells us that what we have done is not remotely enough. More departments, both urban and rural, need to invest the time, need to invest the money, need to invest the manpower in adequately training officers to deal with individuals with mental illness. Models such as the efforts currently taking place in New York, the systems already in place in jurisdictions like Oregon, can and should serve as roadmaps for other departments. Research from these programs is positive for both the department and the community, and as I'm going to discuss in a minute, CIT offers a new way to integrate the field of therapeutic jurisprudence into law enforcement that ensures a partnership between disciplines that is sorely needed if the actions of police officers continue to adversely affect individuals with mental illness. So what is therapeutic jurisprudence? Well, it asks us to look at the law as it actually impacts people's lives. It focuses on the law's influence on emotional life and psychological well-being. Its ultimate aim is to determine whether legal rules, procedures, and lawyer roles, and that's very important, the roles of lawyers, can or should be reshaped to enhance their therapeutic potential while not subordinating due process principles. And in my original, that's italicized. There's an inherent tension here, but Professor David Wexler, one of the two creators of this school of thought, clearly identifies how it must be resolved. The law's use of mental health information to improve therapeutic functioning cannot impinge upon justice concerns. It's vital to keep in mind, an inquiry into therapeutic outcomes does not mean that therapeutic concerns trump civil rights and civil liberties. In its aim to use the law to empower individuals, enhance rights, and promote well-being, TJ has been described as a sea change in ethical thinking about the role of law, of movement towards a more distinctly relational approach to the practice of law, emphasizing psychological wellness over adversarial triumphalism. That is, TJ supports an ethic of care. And one of the central principles of TJ is a commitment to dignity. Professor Amy Ronner describes what she calls the 3 V's: voice, validation, and voluntariness. Here's what she says. What the 3 V's commend is pretty basic. Litigants must have a sense of voice or a chance to tell their story to a decision maker. If that litigant feels that the tribunal has genuinely listened to, heard, and taken seriously the litigant's story, the litigant feels a sense of validation. When litigants emerge from a legal proceeding with a sense of voice and validation, they are more at peace with the outcome. Voice and validation create a sense of voluntary participation, one in which the litigant experiences the proceeding as less coercive. So the question is this: to what extent can or should TJ be employed to remediate the current situation of needless arrests and a lack of available mental health services for so many of those who wind up needlessly in jails and eventually perhaps in prisons? That's the issue I'm going to address next. Now, many scholars have argued that police are among the players, quote unquote, in the legal system whose application of the law has TJ implications. Well, this takes on much more immediacy when we realize that there's evidence, at least in some jurisdictions, that police officer stereotypes include the idea that it is not possible to have a meaningful conversation with persons with mental disabilities, that all mentally disabled people are irrational and none can be reasoned with. These are responses that police officers have responded to questionnaires run by departments of psychology and criminology. Such attitudes, besides being demonstrably wrong, are as antithetical to TJ precepts as imaginable. The problems are exacerbated even further when we acknowledge that police officers who can reliably understand the factors that relate to mental illness may be more apt to decide to access mental health treatment in lieu of arrest. So what's the connection between TJ and the need for alternative models of policing? Well, one of the most important aspects of TJ is the insight that showing respect to all in the legal process results in enhanced psychological well-being and in more favorable outcomes. Research on CIT programs has shown that when police interact with civilians with respect from the initial stages of the interaction, did not use an approach in which threats or force predominated, citizens were more likely to perceive that procedural justice had occurred and more likely to comply with police directives. The research has consistently shown that promoting procedural justice has never been a central concern of the law or the formal systems of discretion that populate police organizations. This is even more problematic in light of evidence that prisoners who feel they were treated in a procedurally just manner were statistically less likely to be reconvicted in the 18 months following their release. And there's evidence that procedural justice shapes legitimacy in questions of policing, providing legal authorities with a clear roadmap of strategies for creating and maintaining public trust. There has been, I think, remarkably little written in the TJ literature about policing issues. Earlier, I've considered, in an article I wrote with my colleague Naomi Weinstein, how coercive police authority by shaming and intruding on dignity violates therapeutic jurisprudence. There is some important TJ literature on how TJ should inform what police should do in responding to domestic violence calls and interviewing juvenile suspects. New York City Mayor Bill de Blasio has just issued a plan that includes expanding training for police officers that will enable them to better recognize the behaviors and symptoms of mental illness, to learn techniques for engaging people in respectful, non-stigmatizing interactions that de-escalate crises. This is going to be a standalone 36-hour training in its initial iteration that's going to engage more than 5,500 officers in 2 target areas. I believe these areas are going to be the South Bronx and Spanish Harlem in New York City. And certainly the creation of this training program accords with TJ precepts. Perhaps the most relevant consideration of this issue is an article by the late Professor Bruce Winnick, who along with David Wexler was one of the creators of TJ, discussing the transport by police of persons with mental disabilities to hospitals as part of a civil commitment proceeding. Patients felt less coerced when police understood their fearful or their confused emotions and explained the commitment process to them. Writing about Winnick's article, Professor Thomas Barton said, involuntary commitment proceedings are thus resolved with fewer adverse side effects where the police depart from their narrow role as implementers of a legal judgment or order and instead engage in the most rudimentary of dialogues intended to aid the problem holder's adjustment to a difficult environment. Now, the literature on the positive impact of CIT programs is entirely in line with Winnick's insights. Implementation of CIT teams have been shown to lead to fewer arrests of individuals with mental illness, improved access to psychiatric care, fewer injuries among mentally ill individuals who come into contact with police, and fewer jail suicides. This is win-win, win-win. Other studies have concluded that after receiving CIT training, officers reported improved attitudes regarding aggressiveness with individuals with schizophrenia, more support for local treatment programs, greater knowledge, and lower levels of social distance. And the study findings supported the hypothesis that an educational program for police officers may reduce stigmatizing attitudes. I've written elsewhere that TJ may be the best possible solution for dealing with such stigmatizing attitudes. I've called that for years saneism exhibited by attorneys. There's no reason to believe it would be less valuable to those attitudes when exhibited by police officers. Speaking of attorneys, I think it's essential that the population in question that we're talking about be afforded effective counsel. Again, Professor Amy Ronner and Judge Juan Ramirez, who I believe is a Florida judge, have characterized the right to counsel as the core of therapeutic jurisprudence, and I agree. I've argued before in the context of right to refuse treatment litigation and the question of incarceration of juveniles with mental disabilities, the failure to assign experienced counsel bespeaks a failure to consider the implications of therapeutic jurisprudence. To the best of my knowledge, none of the literature on CIT programs